Welcome back to Postgame. While staying in shape is essential to an athlete's career, we all know exercise is good for the rest of us as well. The holidays for many are a time to reset the old workout button and promise this is the year we're going to get in shape. It's not always easy, but what if you not only follow doctor's orders to get moving, but walked with your doc as well? That's what's been happening at one clinic in San Diego, and the idea could catch on. Jane Mitchell joins us now with the story.
First of all, full disclosure, the doctor you're about to meet is a friend of mine. And when we were catching up on life and family, he shared with me his idea, walk with your doc. And I immediately said, wow, this is something people need to know about. This is something that could help so many people. And it all begins with a first step. Dressed in scrubs and a smile, Dr. Michael Moreno zips up the stairs of his Kaiser Clinic in Rancho San Diego, greeting every workday as an adventure.
What do you love about your job?
It's different. It changes from one exam room to the next. It's, you know, you can go from seeing a 3-year-old to a 90-year-old.
Morning. Good morning. How you doing?
I learn probably as much or more from my patients as they learn from me.
Like what?
I have a lot of elderly people that I take care of, and a lot of them have been married like 60, 65 years, and it just blows me away.
Anybody in your family with a history of skin cancers or any other skin issues that you're aware of?
And he always asks a patient if they're exercising.
If there's a stall, I know the answer is no, because to me it's a yes-no question. So it was a patient of mine who said that they had stopped exercising because they didn't have anyone to exercise with. And I thought to myself, well, you know, I don't exercise with anybody. I said, but, you know, you could exercise with me if you wanted to.
The light bulb went off, flyers went up, come walk with your doc, Tuesdays and Thursdays, 7 a.m. Dr. Mike, as he's called, began his experiment under a full moon and with anticipation of who would show up by daybreak.
How are you?
How do you do,
Hi,
doctor?
pleasure. Mike Moreno.
Moreno.
Yeah, just call me Mike. It's easy.
Okay.
So, you know, the first day we had about 8 people. It was great.
We got a good little group. Actually, we got a few more than we did Tuesday, so let's do it. This is the first hill.
Then it grew, and then there were 15, and then there were 20, and the most we had was about 35 people. Sometimes they ask medical questions.
You know, the other thing we could do is give them a little supplement to take every day.
Sometimes we just talk about life.
She does. She just needs a few of us to push her a little bit.
Mike Moreno's sincere bedside manner comes from his life experience, the youngest of 7 children, raised by his parents in California's San Joaquin Valley and Visalia. His mother especially encouraged education.
She was a teacher for 40 years. My father worked in janitorial and worked in high schools and grocery stores and things like that.
He was fascinated by science, inspired to follow in his oldest brother Mark's footsteps of becoming a doctor when they lost another brother, Jerry, in a motorcycle accident.
The whole idea of you know, life and the quality of life and, you know, losing someone or having the ability to save someone, it kind of, you know, struck that chord.
From UC Irvine to medical school in Philadelphia, residency in Fontana, and a decade of family practice in San Diego.
I've been fortunate or unfortunate, depending on how you look at it, to have been through a lot of things.
Including losing his 82-year-old father to heart disease. Bianca Pitty's father, who has diabetes, is Dr. Mike's patient.
That's the only reason why I started. And like I said, he's been on my dad's case to get out, so we're gonna work on it.
Even on our more recent visit to a walk with your doc, enthusiasm is evident.
Oh, he's terrific. He's just a good doctor, and he's a lot of fun, and he's busy and active, so it makes you want to do something.
Are you feeling a difference by coming out and doing this in the morning?
Oh my goodness, yes. Just feel absolutely wonderful. In fact, we go the second mile.
Oh,
yeah,
really?
We usually make 2 laps around. We leave everybody else in the dust, so we figure we better go around twice to make up for it.
Dr. Mike's mantra, exercise is a great stress reducer.
At least it's a good start to the day. Gets you going, gets the blood moving.
It's the cheapest medicine there is. It has the least side effects. It's nothing but benefit, and it's that one wonder pill that we're all looking for, and it doesn't come in a pill, and it's free. And it helps a lot of things, and I think it can make a big difference.
His colleagues applaud him.
He's just very, you know, motivational and charismatic, and I think that it's really drawn a great crowd, not only of his patients, but of other physicians' patients, his staff.
So it's been a really positive effort.
Why can't doctors exercise with their patients? It takes a little time, but it's not a lot of time. And the benefit that you get is tremendous. And you know, it started at this little clinic, and it started with us doing our little walk. And you know, eventually I would love to push it to other clinics and throughout San Diego and as far as it'll go.
What if you walked with me? How about that?
When you look up Walk with Your Doc on the internet, you'll see others have used the catchy phrase, but it's mostly for organized fundraising walks, rather than a doctor leading regular walk outings. Dr. Mike has been on the nationally syndicated show The Doctors to talk about his idea. Now, he also suggests a minimum of 30 minutes of walking or exercise at least 2 to 3 times a week. For a link to his site and other tips, go to my blog at 4sd.com. Now, get walking. Your health and heart will thank you for it. I'm Jane Mitchell for Postgame.
Great story. Just walk after we're done, right?
Yeah, exactly.
Don't
walk yet.
Meter click.
Walk in the morning. We're not even on then.
When we continue here on Postgame, Tony Jr. spends a pre-Christmas night gathering toys and bowling. You'll see Tony in the gift-giving mood and collecting mood next.